So, good afternoon, everyone. Thanks so much for joining our seminar series, co-hosted by Departments of Community Health Sciences and the O'Brien Institute for Public Health. I'm Paul Ronksley. I'm the Associate Professor in the Department of CHS and one of the Associate Scientific Directors within the O'Brien Institute, and I'll be moderating today's session. For those of you that don't know, this fall marks the 10th anniversary of our naming donation from Gail and David O'Brien. And to commemorate this milestone for the O'Brien Institute, we're really excited to host this alumni spotlight panel where we hope to showcase past Institute members or CHS graduate trainees that have made great contributions to the field and have pursued unique career paths. I know that hopefully we have some students online with us today. And there's always that apprehension, those nerves that come with the question about what's next after grad school. So this is a really great opportunity to hear about the unique paths that some of our colleagues have followed after their degrees. And I hope that you're inspired by the stories and maybe some of the challenges that they faced and decisions that they've made that have led to their current roles in public health research. So before we start, I'd like to acknowledge and pay tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Districts 5 and 6. And we're all very fortunate to live and work on this beautiful land. And it's one thing to say this land acknowledgement, and I've been trying to add my own personal commitment to truth and reconciliation. And personally, I've always struggled with how to start learning about our history. And fortunately, a colleague of mine, Pam Roach, provided me with this book, which I thought was an excellent read, 21 Things You May Not Know About the Indian Act. It's a fairly quick read, but a very eye-opening read. So very informative. Anyone's kind of looking for a starting point to understand our history, this was something that I really enjoyed reading. So if you're looking for a book, I'll just put that out there. So with that, I have the pleasure of introducing our three panelists for today. So first is Dr. Pearl Yellow Old Woman Healy. Pearl is a member of the Siksika Nation and has worked in private, provincial, and federal school systems as a special education teacher for over 20 years. She has a PhD from the Department of Community Health Sciences. She specialized in CRDS, the Community Rehabilitation and Disability Studies. Her community-based research focused on health and wellness for Siksika children with extraordinary needs. And she continues to work in this space to improve cultural competency around healthcare needs for Indigenous children. So Pearl, thanks so much for joining us today. Our second panelist is Dr. Erin Hetherington. So Erin is the Director of Health Programs at the Trache Family Foundation, where she works in partnership with community-based organizations to improve access to healthcare for marginalized communities in the Greater Montreal area. Prior to joining the Trache Foundation, Erin worked as an epidemiologist for the Public Health Agency of Canada. She worked as a research fellow at McGill and the University of Calgary, and also in international development at Oxfam America. Erin holds a PhD in Community Health Sciences from the University of Calgary, a Master's in Population and Public Health from Harvard, and a Bachelor's in Political Science from McGill. So thanks for joining us today, Erin, as well. And finally, we have Dr. Kieran Dhaliwal. So Kieran has years of clinical experience in acute care and corrections health, and she's worked as a nurse educator for a number of years. She completed her master's in nursing and then a PhD and postdoctoral fellowship in medicine. Her research focuses on the context of incarceration, and she also does some work in chronic disease management in the general adult population. And Kieran currently holds a leadership role in Alberta Health Services and holds an adjunct clinical associate position within the Faculty of Nursing here at the University of Calgary. So thank you again for joining this conversation today. So maybe to start, it would be great if each of you had 5 to 7 minutes just to tell us a bit about your career paths and discuss maybe how grad school or even life experiences may have helped shape your decisions along the way. So we'll go in the opposite order. So we'll start with Kieran first, then we'll have Erin go, and then Pearl. So Kieran, take it away. You've got 5 to 7 minutes to kind of tell us a bit of a story.
Thank you, Paul. So I'm hoping there are some students online that will find some comfort in my words. So I've recently completed my postdoctoral fellowship in medicine here at the Cummings School of Medicine. And prior to that, I finished my master's and my PhD, and I kind of knew right off the bat that I did not want to go into academia. So hence I am in the position that I am in right now. But as Paul mentioned, I actually come from a professional practice background. So my first undergraduate degree was in nursing. And then as a result, obviously in Canada, we have to write the RN exam to obtain our license. So I did that and I started practicing in acute care and corrections health. That obviously led to me having different types of different topics and research questions and whatnot emerged in my mind. And that led into grad school, where I then decided from the plethora of the topics that emerged from acute care and corrections health, I decided to focus on corrections health as a topic in grad school. And that came with some challenges in terms of trying to find experts and committee members, but that's where my interest lied. And so I ended up focusing on that in grad school. It was during grad school when I developed more connections in terms of network. So obviously I've worked with multidisciplinary team members in clinical practice, but because of grad school, I was able to now again work with physicians and pharmacists, but in the context of research. So then it was in grad school where I became exposed to research. And then after my master's, I was encouraged to pursue a PhD. And so along with kind of undertaking my student research, I was able to work on research with different clinician scientists and nursing and medicine. And I know one of our potential questions on our panel is what other extracurricular activities did you do? And I did a lot of them, so I can talk about them later. And then to kind of take a little bit different, to take a little bit of a different route, to expand kind of my research skills and interpersonal skills at networks. I ended up doing my postdoc in medicine. So I was able to network further and participate on big research projects. I had my own funded work focused again on prison health, but then I also had the opportunity to work on other bigger projects like clinical trials with my colleagues in medicine. And then, yep, I knew I did not want to go into academia. So I've kind of come back home to my roots. This current leadership position is focused on nursing. So it's really nice to have gone through all the learning that I did to kind of come back full circle and to be again focused on my area of nursing. But I still continue to work with and interact with my colleagues from medicine. I'm still finishing up publishing and presenting my research as a postdoc. I'm still working with my colleagues in terms of the other clinical trial projects and stuff that I've been involved in. And then I did take up an adjunct appointment. I just started that this year, and so that's even further enabled me to stay connected with the university community. I'm still supervising students and mentoring students, so I think I'm still doing some of those things that you do as an academic, but I'm just not in that role. Officially, I'm not in the role, but I'm still doing the research and the supervision and the mentorship of students, etc., teaching. So that's kind of me in a nutshell.
That's perfect. Thanks so much, Karen. Aaron, would you like to go next?
Sure, thanks, Paul. So I would say, reflecting on my academic career, I've had a pretty interrupted academic career. I didn't go straight from undergrad to master's to PhD. I always took time in between each of those steps. So I did an undergraduate degree in political science, and then I worked for the nonprofit sector in community development and advocacy for a while. I then did a master's in public health, and I was focusing on global health. And after that, I worked for the University of Calgary, developing research projects internationally and training opportunities. For Canadian students and for students overseas. I then did a PhD at the University of Calgary, looking at perinatal health and child development in a Canadian context. With Suzanne Tuff and a longitudinal cohort that's been based in the city for a long time. And after that, I did two postdocs, both of which focused on perinatal health amongst immigrants and refugees in Canada. And while I didn't start out my career thinking I wanted an academic track, once I'd been on it for a little while, that became sort of like it became very evident that I was good at it, and it was kind of the next step. And once you're in your second postdoc, you really are quite clearly on a path to an academic career. There are two things I think that sort of changed me from that pathway. The first being a personal one, for reasons associated with the COVID-19 pandemic, and all sorts of other factors, my family and I relocated to Montreal, which is where I'm from originally. And we decided that our values no longer aligned with traipsing all over the world. And we wanted to stay in Montreal, and we wanted to build a life here, which then meant that in terms of academic possibilities, my options were reduced down quite a bit because I wasn't willing to relocate. And so that was a values-based judgment that made it sort of, how long are you going to be in a postdoc waiting for the perfect position to open if you're not willing to move and change your life? So that was one thing. The second piece is, like I said, I've done a number of different things in my career, and when you look back on that, you think about like what is the through line, like what is the thing that brings all of these things together and makes it what motivated me. And I've always been motivated by a desire to contribute back to society, to address inequalities that I see in society. As a white woman from a privileged background, I've had to think carefully about what that looks like, how to do that in an authentic and engaging way. And being good at school, meant that I often did that by contributing to the research and evidence base. And so that was really important to me as part of my academic trajectory. But it's not the only way to do that, right? And the more I did research and I contributed to that evidence base, which was important, the further away I felt from the communities that I was actually hoping to have an impact on. And that made me think about what were other places that I could do work that was meaningful to me from a personal level, that used the skills that I had, but were not necessarily in generating more knowledge. And so I briefly worked for the Public Health Agency of Canada, which I can talk about more if people have specific questions. It wasn't a good fit for a number of reasons, but I now work for a family foundation here in Montreal. And for those of you who don't know the world of philanthropy, I'll just spend a minute sort of explaining what I do and what my job is. But basically, I work for a family foundation. They have it's a private large endowment. We give out granting money every year to different charitable organizations working on different causes. So the Trottier Family Foundation has long worked in the area of climate change, working against climate change, reducing greenhouse emission gases, these types of things. After the pandemic, the family decided they really wanted to work more actively in health and in public health, sort of having seen what a devastating impact a disease like COVID can have, not only on the general population, but specifically on people who are already facing challenges in their lives. And so they hired me to help them develop strategic priorities in what we're calling community health. So sort of what is healthcare before you get to the hospital door. So with them, I've helped them kind of think about what are the places where a foundation can intervene in terms of granting money, but also in terms of advocacy initiatives. So we developed out that strategy. And what I do in my day-to-day job is not only do I receive grant applications for projects that people want to carry out to improve access to healthcare, that's part of what I do, but I also work in collaboration with governments, with representatives of the healthcare system, with community-based organizations that are all trying to address these really wicked problems. And I can often act as a convener, bringing people together to see if we can untangle some of those wicked problems and push for actual sustainable change. So I'll wrap it up there for my journey. But I love my job. It's really great, even though it's not academic.
It sounds like a really nice mix, though, between having a really close hand with community partners and then having your research hat on there as well. So I think that you found a really nice niche there. Thanks, Erin, for that. And move on to Pearl for your reflections.
Okay, Adamix Ganotini. My name is Pearl Yellowdomin Healy. I am half Blackfoot from the Siksika Nation on my father's side, and I am half Ojibwe Cree on my mother's side from Red Sucker Lake, Manitoba. So I always start with cultural protocol in introducing who I am as an Indigenous person in this space. So in my journey, I became a mother at the age of, I got pregnant at 16 and I gave birth at 17 years old. My daughter is now 31, and she's autistic with uh, um, medical complexities, just 10 different diagnoses. So hence her being born, paved the road, for this journey that I took on life. I wanted to go into law, but that quickly took a quick turn when she came along, and autism became my world. And so I became a special needs teacher because I wanted to learn how to become a better advocate for her and for others, other children, Indigenous children that I was seeing in the community that had these high exceptionality needs. And when I was in the system for many years, I really started seeing the systemic differences in inequity regards to educational funding, even the health inequities for our children with these with high medical needs. And so I started to question, really, I find that I was becoming the only resource in the classroom for children, and really started to ask myself, is there changes that I can do, you know, to enhance the lives of our community members, our children that I'm seeing in the classroom, and and in my own daughter, advocating for her as well. So that led me to having I finished with first I had a Bachelor of Arts degree first, and my mom just said, "What are you going to do with that?" Oh, okay. So I went back to school and became the teacher. And then I went back to community rehab and did a master's there to really look at those systems. And then after that, went into like, I didn't go right after another two because I was a single parent. I was working, I was going to school. So I had to go to school, work, go to school in that fashion. I also didn't grow up from a privileged background. I grew up in extreme poverty, and I had to really fight my way through life. And I had to fight for funding, and I had to fight uh, racism. I had to fight stereotypical encounters in academia in those spaces. It was really hard during my first 3 degrees to really find a safe place. I didn't really have colleagues or connections in academia or mentors at that time. And so when I decided to go through a PhD, I thought it had to be different. I needed to do something different, and I just took a shot. I applied, and not knowing, I was terrified, absolutely terrified. I felt like I didn't belong. I walk into a room, I don't see any other Indigenous people, and it wasn't a space where I felt welcomed at that time. And I just knew that I needed to be committed to finishing this PhD that I had started. And my supervisor was Ann Hewson. So I walked in at that time. When you go to a PhD, you had to go and find your own supervisor. And while I'm walking in, I don't know anybody. I don't have any connections with anybody, but I had met her through the master's program just a couple times, and I just took a shot and I said, "Hey, I'm just gonna say, will you be my supervisor? Because I don't know anybody, and I don't know who to ask." So, and she's like, "Yeah, okay." So I lucked out on that. So she was a fantastic nurturing supervisor, and really gave me that confidence to keep going and saying, you do belong here. You need to trailblaze that way for other indigenous students coming in behind you, that you can create a change too in your own way. And so um, that's kind of where I went through that path. And I'm sure there's more questions later, but thanks.
No, that's perfect, Pearl. Thank you. And thank you all for sharing your journeys, being very vulnerable and open. Obviously, you've all highlighted very unique paths that have been value-based, but also based on personal circumstances, which I think is really important for people to hear. For our online audience, we do have a question and answer box that you can post your questions in for the panel, and then I can read them off as they start coming in. But maybe I can start with a question to start our conversation. Just maybe thinking back, I guess some of you talked about it a little bit, but during grad school, everyone takes a lot of courses. And were there certain courses, or activities, or even events that you attended that you recall being really helpful in helping you make your decision about what you wanted to do, but what you didn't want to do after grad school? Does anyone want to take a shot at that?
I'm happy to jump in. I was really fortunate in my PhD is that I had a defined project, but I also had a supervisor who let me explore like lots of different side projects. And so being someone who likes to work with community-based organizations, I took every opportunity that I could to kind of work on side projects that I knew wouldn't necessarily contribute to my PhD or result in a publication, but allowed me to build those links to community. And so that might have been taking on a student summer project that was like a smaller piece of work that might not end up as a publication, but was still of value to the community-based organization. I also, because I was working on a longitudinal survey, we did survey development, and that required a lot of consultation with different groups. And so that's not necessarily a skill that you would think about that you would get in a course, but it required me to go out and talk to different types of people, different stakeholders, and figure out what they all had in common so we could collate all those things. So it was really around kind of looking for those opportunities that aligned with my interests. So it wasn't like I wasn't completely off in left field, but it allowed me to do different types of projects. One thing that I would recommend that I did not actually do, but I think would probably be really beneficial is opportunities to do research communication. So one thing I've noticed a lot is that a lot of researchers have extremely technical skills and can speak very, very well about the particular area, but I have a hard time communicating that to a lay audience. And so things like the 3-minute thesis, or really understanding how to boil down that super complex knowledge into 1 or 2 bullet points is a really, really key skill. And I'll give one example and then I'll pass it on to the other members of the panel. But when I'm pitching a project to my executive director or my board, I might have 3 minutes. Like that's all I have in order to communicate what is the problem that we're trying to address, how are we going to address it, and why this is the group to invest in. And that's it. And if they ask me a super specific question, I have to have all of that in my back pocket to be able to answer it. So all of the skills and knowledge still has to be there. But if I can't get it across in 3 minutes, it's not going to go anywhere at all. So those like being able to really distill ideas and communicate clearly, I think would be something I would highlight.
I can go next quickly. Heather mentioned some pretty good points that have helped me kind of recall a few things from my experience. So not having been at a grad school in my postdoc life too long, like Heather said, I had the opportunity to work on different projects. And that enabled me to build more networks beyond just, my current network. So that was really important because networking with other people a few times led to some other cool opportunities that I could participate in as a trainee and as a grad student. So that was really important. The research communication pieces, Paul, Dave obviously closely, and him, Dr. Campbell being my supervisor, he's really good at putting us students on the spot. So there would be times where he knew that I was probably more on the shy end in our lab team. So he would always say, hey, guess what? We're gonna have a big giant team meeting today and you're presenting, or hey, guess what? The Libin Institute is having a retreat and you're gonna be signed up to present. So I think as a student, those were probably good opportunities now that I look back, in which I was kind of forced to come out of my shell and present and, work on my research communication skills. So it was really good to engage in those type of opportunities. And I also did other things as well. For example, every now and then, we always have research not research, but newsletters and whatnot coming in from, you know, a trainee group from the Libin Cardiovascular Institute. And sometimes they would reach out to us senior grad students or postdocs and say, hey, we're having like this research day for our students. Can you come be an abstract reviewer? Can you come be a poster reviewer? And so I really enjoyed going to those events and like participating and not only continuing to develop my skills, but again, I was able to network with different people as well. So I feel like I was always involved in different kind of activities in nursing and medicine and across the campus. So I would definitely encourage students to do that because it builds your networks, and sometimes you end up having a really cool opportunity in front of you that you can pursue.
Pearl, anything you want to add to that?
Hmm. Yeah, so when I started the PhD program, a new initiative had just started at the Cummings School of Medicine, the Alberta Indigenous Mentorship and Health Innovation Network. And so it really, I think without that support, I don't even know if I would have finished the PhD program in the 4 years that I did. I just wanted to get it over and done with. I didn't say not no to academia. It was just like, Greater doesn't have that in store for me right now, but it could be a possibility later. But my vision and goal when I came into this PhD was to see how I can create systemic change for my people in community. And so putting theory to practice, implementing those practices, really seeing firsthand with community members, our people, what are those challenges that we're seeing, and then finding solutions through our networks, like and so forth. And so it was a really great opportunity having that mentorship, you know, because you had different skill levels of different professors. And that was Dr. Cheryl Barnaby. You know, she was so influential and just given that time to you, reassuring you on answering questions that you had and not being. What I loved about this whole group is there was no condescending, you know, actions, because sometimes when you ask people, well, you should know, you know, you're here now, you're at this level, but it was none of that. It was very nurturing. It was very safe to ask questions, even if you didn't know. Dr. Lindsay Crowshoe, Dr. Rita Henderson, Dr. Jennifer Leeson, Dr. Pamela Roach, Dr. Adam Murray, Dr. Carly Fellner, Dr. Jackie Ottman. So these were my Indigenous mentors in academia that really, really helped me as an Indigenous graduate student focus on creating a dissertation and project that really, really was meaningful, you know, that could, you know, create that sustainable change that we see that for those issues that need addressing, and bringing that to the forefront, creating that awareness. And so for me, and through that mentorship, you know, they provided sweat lodge ceremonies, opportunities to reconnect the culture, bring in the language and bring in the elders, allowing you to smudge in those spaces. So those were really important for me in my graduate program. Thanks.
That's perfect. Thank you. Sounds like a lot around mentorship and growing your professional network is really important, especially in grad school. Maybe I see there's no questions in the question and answer box right now, but for a second question, what do you know about the cohort of graduates that you went through with? Like, can you tell us, did you keep in touch with any of the students that you worked with through your coursework? Are they part of your professional network now? I know that for me, I went through grad school and have a lot of people that I still keep in touch with. For some people, that's not the case. So any reflections on that?
I think so nursing's is a little bit different for us. Once you've completed a master's degree, it doesn't necessarily have to be a master's, but there are certain roles that you can take if you're still kind of working in that nursing world. For example, you can kind of level up to become a clinical instructor. Nursing management oftentimes requires nowadays a minimum master's degree. So some of my colleagues have gone on to pursue, for example, the nurse practitioner program. So they engage in advanced nursing practice. I know one has a kind of I think a bit of a leadership role here at the Libin Cardiovascular Institute after her master's. And then she went on and did a doctoral program as well, but it was not research based. It was, I think, something to do with education. And then there were some colleagues that did want to go into academia, different from me. So they're in academic positions now. So I have, like Paul said, I've stayed in touch with quite a few people, and of course with my colleagues and friends and peers that I was around during my postdoc. We're still definitely in touch. Some of us are on research projects together. We still work together. So I have seen many of my classmates and fellow trainees kind of they've elevated themselves in their careers after their graduate education and are in positions that they are enjoying. So that's really nice to see. And a few of us are still connected in terms that we've actually come back together and are working on new things and new research projects. So it's been nice to see everybody grow, and I have been able to keep touch with a handful of them.
Thanks, Karen. Erin?
Yeah, I've also kept in touch with lots of people from my cohort or people I've collaborated with on specific research projects. And what I find really interesting with that is, I mean, lots of people have stayed in straight research. Lots of people have gone to work for Alberta Health Services or another sort of governmental public health organization. There have been people who have joined more consulting firms that are doing more kind of technical research projects, that kind of thing. What I find really interesting though is to play the 1 or 2 degrees of separation game. When I meet a new person, is to kind of figure out where we might possibly know each other from, and usually it doesn't take too long to kind of do that daisy chain and get back to someone that we both knew in common, which always I think helps establish a rapport, which is nice. And then people I find are generally very generous with their time, even if I haven't talked to someone for a couple of years, and I send them a quick note and say, hey, this came up. I thought you might be interested in this opportunity or collaboration, or maybe you can give me some insight on this. And keeping those networks alive doesn't necessarily mean that you need to be emailing them every week, right? Like you can go a year or two and people generally still respond. The other quick thing I just want to say about networking is I found it especially in my grad career, like something that I did not think I was good at. I found it really hard, especially at academic conferences. I found them really intimidating. I would consider myself a shy person. I had a hard time reaching out to people. But I knew it was important and I didn't know how to do it. And so I would actually set myself goals of being like, okay, today I'm going to meet 3 new people, and like one person can be in the coffee line, and one person is someone I ask a question of after a talk, and then the third person, like whoever, we can figure it out. But I would set myself those goals, and I set them low because I was like, if I set it at 10, I'm never going to make it, right? So it'll be like 3 people. I got to meet 3 new people. And then at the end of the day, I would be like, yay, you met 3 new people. Good for you. And once I'd done that a few times, it wasn't as hard, right? But it was just setting kind of those concrete goals and figuring out how to do it that helped me broaden out those networks.
Great, Erin. Thanks so much. Pearl, anything you want to add to that?
Oh, I just think that, also too, when you're going through that process, it can be very isolating, because you're doing the work and nobody's going to do it for you. Right? So it's really hard to also connect. So sometimes, if your topics aren't, you know, in alignment, and people have no idea about Indigenous health, don't know how to help you out. But however, the personal connections and relationships, remain to this day. So, also too, through the Aim High network during COVID, they developed a talking circles, virtual circle support group. And we got together every 2 weeks with elders and grad students and faculty members. And that really, really strengthened our bond as people, as human beings, connecting in one space. And to this day, our friendship, continues, and we support one another. And I am so thankful for that opportunity, that I have sisters and brothers now that we call in Indigenous culture when they make such an impact in your life and they're part of your life, you know, and I have that now. So I really, really appreciated that. Thank you.
That's great. Thank you, Pearl. I see we've got a question here, and it's from Rosman. And you know, the question that I was going to ask next is very similar to her question. So mine was going to be, what has changed most in public health and the health research landscape since your time as a grad student? And maybe how do you think that will affect our current trainees and our supervisors? And I guess to kind of tie that into Rosman's question, it was around how do you think artificial intelligence, AI, may affect our current and future career activities? So maybe just thinking more broadly, though, have you seen any changes within our public health and research landscapes since when you were a grad student to maybe what we see now?
I love this question. I'm happy to jump in first. I wouldn't say that this has necessarily changed since I was a grad student, but it's just become more dominant. And it feeds well into the AI question, is just the predominance of big data in research. And so with the digitization of health records, administrative health databases that are becoming more accessible to researchers, this is becoming a big area of public health research. And there's a lot of really great questions that can be answered with electronic data, with administrative data. The thing that I worry about with that is two things. One is that we tend to think of these big databases, because they have such big numbers and we can really look for things in these huge samples, you know, that these numbers are, I don't want to say free of bias, but are kind of like, they're bigger, so they're better, right? And behind every number that goes into an electronic database is a human that has made a decision about how to collect that number, why to collect that number, what they're not collecting. And so if you are only looking to that type of data to answer your research questions, you're missing a lot, because you're not thinking about what are the questions that led to that database being that way and set up that way. So that's just a piece of caution. And then similarly, who are the people who are not in the databases? So I work a lot with precarious status migrants. These are people who do not have provincial healthcare cards. They don't have refugee status, so they don't have any central identification mechanism. And so they are not in any of these databases. So you want to know what's happening to refugees who are coming here, or refugee claimants who are coming here and getting pregnant and don't have access to healthcare, and what's happening to their kids. We can't answer any of those questions using administrative data, because essentially those people don't count. And that may sound like a little bit extreme to say that, but if you're only relying on the numbers and on the big information, you're forgetting about those people that are not included in those populations. And finally, what I'll say about AI is that I think that there's tremendous potential for AI. I think that we have to remind ourselves that AI currently, in its current context, is essentially pattern recognition. And so we are only recognizing patterns that we have already seen, and those patterns are developed. You know, it doesn't let us think beyond the things that we already have. And if we're not questioning how those data got into the system, why some data were collected, why we think the thing that we're naming, you know, race, for example, how that was measured and how that might be measured wrong. If we're not asking those questions, we're just replicating patterns that are not actually giving us new knowledge. So I think there's a lot of potential, but I always want to say, like, remember to think behind those trends and what are the people and the things that are excluded from big data.
Thanks, Heather. Kieran, Pearl, anything to add?
I think I definitely agree with everything that Erin said. There is good, and some people will say great potential with the integration of AI into the health world, but there are also limitations as well. And it's interesting because I'm definitely no AI expert. I was at a workshop recently held by the library here at the University of Calgary. And they presented about, you know, the integration of AI into publishing processes and whatnot, and how authors are using that to write manuscripts. And they actually gave some examples, which they found, or I think from their networks and whatnot, of where AI has failed, where it did something it wasn't supposed to do, and it was very eye-opening and not surprising. But in terms of, I kind of think about research topics, and I remember that, and again, not being at a grad school for too long, AI has been talked about for quite a, for the last couple of years, quite a bit. And so I recall some supervisors would say, oh, well, this is something that's trending right now. Maybe you could turn that into a research topic because you might be able to win some funding, right? So I do find, and I saw during my graduate school that sometimes as students, we would try to pursue some of these topics because we knew that they were trending and they were now, labeled as novel. And so I guess you can think about things like AI in that sense as well, in terms of you trying to pursue something in regards to that as a student. And then there's also implications, like Aaron said, right? There's limitations to this, big thing called AI.
Great, thank you, Karen. Pearl, anything to add in terms of maybe your reflections on the research landscape, how health research has changed? If not, it's okay. Okay. We have another question that just came in. Yeah, thanks for this is from Hannah Katani. Thanks for this insightful discussion. I'm curious if you've ever experienced imposter syndrome as a graduate student or throughout your career. If so, how have you navigated that? I think that's a great question, Hannah, that we all experience all the time. Does anyone want to give that one a shot?
One of the when I decided to pursue corrections health, i.e. prison health as a topic, I had a lot of individuals raise eyebrows. Oh, why would you want to work on a topic like that? The people that you're working with are incarcerated for committing crimes, in society. Like, why are you wasting your time? So as a student, it was, I had to advocate for myself and my topic, and the people in these institutions are humans just like us, et cetera, et cetera. So sometimes I feel like they would kind of, I was like, oh, that student who's focusing on, prison health, and the group of us were doing something else. And I don't know, they always thought it was kind of, some people thought it was, I guess they just did not align with it, which is fine. They were always questioning my decision, to pursue this topic because you're working with criminals, that's bad. Like, you're supporting these people or this area. So I would oftentimes get many, many questions throughout grad school and even during my postdoc, because again, I focused on this topic as well.